So is that other one a butt implant also?
Yeah, this one here is interesting. This is an example of why you make sure you go to the right doctor. I actually removed this from a patient who had a buttocks augmentation done in Colombia.
How small was her butt to begin with, though?
Her buttocks is big. It looked like a small little bump on the bottom of her butt. It was like a mini butt on her butt.
This is Susan Yara.
And this is Sharzad Kiade.
Some call this the Sharzad and Susan Show.
Or the Susan and Sharzad Show.
We just call it
the Sass. Sharzad, what do Kim Kardashian, Iggy Azalea, and Nicki Minaj have in common?
Booty! Badonka-donk!
I'm convinced they're not real.
Interesting, Susan. Elaborate, please.
Well, how many people do you know who have itty-bitty waists and a round thing in your face?
One.
Oh, thank you.
That's an interesting trend that started. I mean, is it implants, or are they going south of the border to Brazil to get like new booties? What is going on?
I think it's simpler than we think it is.
I'm dying to know, and I think the best way to find out is if Susan and I just go get some butts right now. Do you want to go get a butt with me?
I'm down for a butt.
Coffee first?
Coffee.
Then butt.
Perfect.
You guys want to come? Let's go.
But really, we're going to a plastic surgeon
right
now, and we're going to find out the truth. So we have noticed this huge trend in the butt. And you know, like J-Lo made it really popular a few years ago, but now I really think the focus is on the butt. And I tend to think that a lot of the celebrities that are known for their butts right now do not have real butts. So I'm hoping that you can kind of explain, because I think it's awesome.
Actually, the most common way in the US of augmenting the buttocks is to do liposuction and fat transfer, which is commonly referred to as a Brazilian butt lift in this country. So what I do is I liposuction the fat from areas that are unwanted, like the love handles or the belly, and take that fat, process it, and then use it to reshape someone. So I can take a woman that's got a square shape and turn her into kind of a more A-frame shape or a hourglass figure. My goal is to get the golden ratio. The golden ratio is about 70% or 0.69, which is the waist to hip ratio. That's what we want it at. And then use the rest of the fat to augment the buttocks and to give it a little bit of projection, depending on how much projection they want or need.
So you're basically telling me that all those times I've said, if I could only take the fat from my thighs and put it in my butt or my boobs, we can actually do it.
That's correct. We can actually do it.
Let's do it now. Okay.
Let's go.
Well, let's say you gain weight after this procedure. Will the fat just move to weird places like your neck or your arms and you just look like a creep?
I'm going to take fat from the areas you don't want it, like let's say it's your love handles. It's still like the area that you genetically like to put fat to. It's your problem area, right? So your body's still going to put fat back into that area. It won't like go to your arms, it won't go to your legs. It'll still try to put it into the area that you like to put the fat into.
So does that mean that the fat that you're putting in the butt, for instance, is going to get fatter if you get fatter?
Yeah, so it still thinks that it's fat from your problem area. So it still thinks it's love handle fat. It doesn't automatically reprogram and think, oh, I'm in the butt now I'm butt fat. It thinks I am still love handle fat. So if that area was the area that you gained weight and lost weight, or if it was the area that you couldn't get rid of no matter what, it's going to do exactly the same there.
Now, can I give Susan my fat, since she clearly doesn't have much, and I've got fat to share?
I'll take it.
People ask that all the time, but I can't. And the only way I could do it if you guys were identical twins, then I could actually take fat from one person to the other. But it has to be your own fat, or else the body would reject it.
What are some of the benefits of the injections versus the implants?
Injections is commonly used for things that are not fat, like silicone, which is not recommended at all, and you've seen in the media that it can lead to infections and really bad problems with the buttocks. The only thing in the United States that should be injected into a buttock should be your own fat. Now, fat transfer or liposuction and fat injections is what is commonly done in the US. And that is with patients that have a little bit of fat, depending on how much you want in augmentation. But I can do this in relatively thin patients that have little fat stores and get a very nice result. But if there's someone that has absolutely no fat, then that's who's a candidate for a buttock implant.
Will this last forever? Am I going to need touch-ups throughout my life?
Not all the fat that I transfer actually survives. About 60 to 70% of the fat that I move survives. And it really swells quite dramatically for the first 6 weeks. So a lot of patients look back and they're like, wow, this is awesome. It's huge. And they want it that way, and it'll come down. It'll come down about half of what it did. What you have at 3 months is what you're likely going to have the rest of your life, as long as you maintain your weight.
So what are those?
So this is a buttock implant, this one here. This is a semi-solid silicone implant which is used for buttock augmentation in the United States.
Oh, it's dense.
Yeah, there are different shapes. There's also an almond-shaped one that approximates the shape of the buttocks more naturally. So depending on the patient's anatomy, what volume they need, that's...
Sorry.
People come in and do this all the time.
Yeah, a lot of people smack the butt implant. There's different ways of putting the buttocks implants in. I actually put them inside the muscle, so that way you can't see the outline of the implant. You guys have seen those videos where they can flip the implant or what have you.
I did see that video.
That's when the implant's not placed inside or under the muscle. That's when it's placed just over the muscle, and it makes it so it can flip.
I guess through this whole procedure then. So if I decide I want to get a Brazilian butt lift, we're in our consultation, what happens next?
After the consultation, I usually see my patients 2 weeks before for a pre-op appointment. And during the pre-op appointment, most patients bring their wish pick, so what they think is a nice buttocks. And that way we can definitely look at the differences in the two and how I'm going to get to that shape. Some people have some really unrealistic expectations, so that's a time to manage expectations and to make sure that this is actually a procedure that they're going to be happy with the final outcome. The day of surgery, they show up, they go to sleep completely. It's under general anesthesia. I do liposuction. It's usually pretty much full body liposuction, any area that I can find liposuction. And then I use everything that I liposuctioned out and then transferred into the buttocks.
This is for sure what celebrities do right now then. It is for sure, right?
I would have to say there are probably a few that have had it done.
So what kind of recovery is there with the Brazilian butt lift?
By a week, most people are ready to go back to work. The biggest drawback with it, or the thing the patients find the hardest, is not being able to sit for at least 2 weeks. I ask them to sit for not 2 weeks, and if they can go longer, they usually do. Most people try not to sit for a month, and I prefer that. And you know, these patients are patients that really want their butt.
Wait, what happens? I mean, does it like deflate if you sit on your butt?
In the early process, when the fat hasn't quite taken, it's a little malleable, so you can flatten it. You can change the shape that I made very early in the first couple weeks. And then after that, the pressure can also cause those new little blood vessels that are trying to make the fat survive not go into the fat and not make that fat survive. So it might decrease fat survival or fat graft take rate. So those are the reasons why patients can't sit for a couple weeks.
You got to learn how to squat when you go to the bathroom then.
Yeah, you kind of have to hover, right?
Yeah.
You can squat. You could do it for a little bit. But they are not sitting for prolonged periods.
Right.
That's for
Got
sure.
it.
If it weren't for the 2 weeks no sitting, I'd be like, sign me up tomorrow.
The 2 weeks isn't that bad for a lifetime of booty.
True.
Thank you so much for all of this information and for giving us the celebrity secret, because I know this is what they're doing now. It's confirmed.
Yeah, and playing with these was super fun.
So I'll be seeing you guys pretty soon for your pre-op appointments,
Tomorrow.
right?
Yeah.
Absolutely.
Tomorrow?
Let's
Fantastic.
do it. Thank you so much, though,
You're
for
very
explaining
welcome.
everything, and it was
Thanks
so
for
nice to
coming to
meet
visit
you.
me here in
Thank
Marina.
you.
Thank you. All right, so I think I'm pretty convinced that this works. I'm not sure if I'm doing it yet.
I'm going to do it tomorrow.
You're gonna do it?
Absolutely.
Well, but do you want to see what I do look like with the butt?
Bend over. Let me see
okay,
that.
this is what my butt looks like. Okay.
Nice. Firm.
This is my real butt. Okay.
Excellent.
And
Good
this
texture.
is boom.
Hey, girl. Actually, there's something I didn't tell you. I actually got mine done as well. We really wanted to like keep it in proportion to my body, so we just went ahead with this small one. And I just love the way it accentuates everything for me.
This is pretty amazing, but the fat injections, that's where it's at.
That would be the way to go.
For sure.
Butt, 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 butt.